Pumping the brakes on Medicare for All, Democrats distancing themselves from presidential hopeful Kamala Harris' suggestion to scrap private health care plans. Harris responding to Fox News earlier today. Listen.
The bottom line and the most important is that everyone have access to health care. That is the goal. That is the purpose for me supporting the policy of Medicare for All, that everyone has access to health care, period.
Let's bring in Hadley Heath Manning, Policy Director at the Independent Women's Forum. Hadley, you know, this is another one of those situations where you have a politician promising something that the math can't possibly support. And I have to wonder if voters are going to believe it. It seems almost cruel. I mean, Medicare, the average recipient, according to government numbers, you know, in their lifetime, pays in 1/3 roughly of how much they get out over time, or it's between 100 and 200,000 is what they pay in. They get back between 400 and 500,000. Obviously, we can't do that for everybody because it's not, you know, mathematically possible.
That's right. Medicare for All certainly ought to concern us all as taxpayers, but maybe more importantly, it should concern us all as healthcare patients. You know, when Representative Harris talks about everyone having access to healthcare, what she really means is everyone being covered by a government insurance plan. That's not the same thing as having access to healthcare. In fact, it could be counterproductive to the goal of accessing real healthcare services. And
they've certainly learned that in Canada and England. And it's amazing to me when you see people who have the luxury of coming to our country to get health care because they're told in their country that, you know, they have to wait and or can't get the thing that they need. And in fact, that was the analogy she used when she was trying to sell it in that town hall. She said, we've all had to wait for approval. You know, from the insurance company, I'm done with that. I'm over that. We need to move on. You know, do you think voters believe this after what they heard about Obamacare? If you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. You know, your costs are going to go down. None of those things came true. Will they fall for it again?
You know, I think especially senior citizens this time around will be concerned that Medicare as they know it today, which is focused on them, will no longer be something that's equally available and beneficial to senior citizens. So I think this plan has a lot of problems from top to bottom, and it's no wonder that so many Democrats are concerned that this is not the right position for their own party to take.
The labeling of it, though, is what could really trick people, because when you say Medicare for All, and then I talk to seniors in Florida who love Medicare because they also have the private insurance supplemental, and they have Medicare, and they have access, and they have what they need. And everyone says, well, maybe each and every one of us could have that. The title itself is so tough.
You know, I think what it would be in reality is much closer to Medicaid for All. Medicaid and Medicare have similar names, two different programs. Medicaid today serves low-income people, but of course doesn't reimburse healthcare providers as well as private plans or as Medicare. And so it's very difficult for patients in that program to get access to a doctor's appointment, for example. And we don't want to do that, certainly, to more Americans.
Hadley Heath Manning, thank you.